Hey guys, so today we'll be talking about magnesium. So what is the role of magnesium? So magnesium regulates your muscle and your nerve function, and it also supports heart health. So when it comes to our signs and symptoms of hypomagnesemia, which is a magnesium less than 1.5, we will see muscle weakness, tremors, seizures, and heart arrhythmias. So it is so important to know that magnesium and potassium, they got this thing going on. They like friends. So they follow each other. So when your magnesium is down, you also want to check your potassium because your potassium could be low as well. So what are some causes of hypomagnesemia? So the first cause we're going to talk about is alcoholism. So with chronic alcohol use, that stops the magnesium from being absorbed in your intestines and causes you to excrete magnesium throughout the kidneys. Also, starvation. Patients are not eating enough magnesium rich foods, which could lead to low magnesium. You also have diarrhea and diuretics. So we want to remember that magnesium is really houses in the GI system. So if a patient has a bunch of diarrhea, they could be excreting magnesia during the bowels. Also, we have diuretics. Diuretics do the same thing. So that causes the patient to excrete magnesium through the kidneys. So let's talk about some treatments. So we can give magnesium supplements. So supplements can be given oral or IV. But I also want you guys to know that if a patient is experiencing hypomagnesemia, they are at risk for arrhythmias, so we want to make sure that we have that patient on a cardiac monitor, okay? And then we also want to look at the potassium level because, like I said, potassium and magnesium are friends, so your potassium may be low as well. Now, let's jump into hypermagnesemia, which is a magnesium greater than 2.5. So what are some signs and symptoms of that? We can see flushing with that patient, which is the redness of the skin, and that is because high magnesium levels lead to vasodilation. And also we can see respiratory depression in this patient, and we also can see patient has heart blocks on the monitor. So one thing that I want you to pay attention is that with hypermagnesium, this patient is at risk for respiratory depression. So let's think about it. So we said that magnesium regulates your muscles, right? So let's think about our respiratory muscles. Our respiratory muscles will be weakened. So if your magnesium is super high, so you're going to see respiratory depression. So we want to make sure that our priority is going to be securing an airway, okay? All right, and then we also can see a heart block. So this patient as well needs to be on a cardiac monitor. So what are some causes? So if a patient has renal failure, which is causing them to hold on to magnesium. Also, if the patient has excessive magnesium intake, meaning that that patient could take a bunch of antacid. Let's say they have bad heartburn, bad GERD, and they're taking these antacids frequently, they could have an increase in magnesium. So our treatment, we can give IV calcium gluconate. So calcium gluconate, that antagonizes the toxic effect of hypermagnesium. So diuretics to get you to pee out all that magnesium. Also, in severe cases, the person may have to undergo dialysis. So you guys, we covered magnesium. So I hope that this lecture helped you understand magnesium a little bit better. But just for a quick thing, when we think of magnesium, we want to think of potassium as well because they kind of mirror each other. And we want to think about it. If our potassium is low or high, this patient is going to have cardiac issues. So we want to make sure that they are on a monitor and that they also can have respiratory issues with hypermagnesium. So we want to make sure that we are securing our airway. Hope this video was helpful.